What if your body could whisper a warning 30 days before a stroke strikes? You might think strokes come out of nowhere, but that's not always the case. Your body often sends subtle distress signals long before disaster hits. And if you know what to look for, you can take action before it's too late. I'm Dr. Carter, and today, I'll guide you through 7 early warning signs of a stroke that often appear weeks in advance. These aren't just medical facts, they're potential lifesavers. Let's start by asking, are you really listening to what your body is trying to tell you? Every year, nearly 800,000 Americans suffer a stroke. That's one stroke every 40 seconds. The saddest part, many of these could have been prevented if only the signs weren't ignored. I've seen patients walk into my office exhausted, dizzy, or slightly off balance, brushing it off as stress or aging. But sometimes, what seems minor is your brain crying out for help. Let me share the stories behind these signals and why they matter. 1. Persistent high blood pressure. Blood pressure, also known as hypertension, is one of the most dangerous early indicators of a stroke. It damages arteries over time, much like a river slowly eroding its banks. This constant pressure weakens blood vessels, making them more likely to rupture or become blocked, both of which can lead to a stroke. There are 2 major types of strokes linked to high blood pressure. In an ischemic stroke, narrowed or damaged arteries allow clots to form, blocking blood flow to the brain. In a hemorrhagic stroke, a weakened blood vessel bursts, causing bleeding in the brain and increased pressure inside the skull. A life-threatening situation. What warning signs should you watch for? Frequent headaches, shortness of breath, and irregular heartbeats might seem unrelated, but they can signal dangerously elevated blood pressure. Left untreated, this condition can quietly damage your brain's blood supply. To reduce your risk, monitor your blood pressure regularly. Cut back on salt and processed foods. Stay physically active, and manage stress through mindfulness or relaxation techniques. If lifestyle changes aren't enough, talk to your doctor about medication. High blood pressure may not come with obvious symptoms, but ignoring it can lead to disaster. Up next, let's talk about another overlooked warning: unexplained fatigue. 2. Unexplained fatigue. Fatigue is often dismissed as a byproduct of stress, a lack of sleep, or a busy lifestyle. But when exhaustion lingers, especially after a full night's rest, it may signal something far more serious: reduced blood flow to the brain. This kind of persistent fatigue is your body's way of saying it's struggling. When the arteries supplying oxygen and nutrients to the brain become narrowed or partially blocked, brain cells don't get the energy they need. As a result, you may feel mentally foggy, physically drained, or unable to focus despite no clear reason. This kind of deep, unrelenting tiredness is sometimes linked to a transient ischemic attack TIA, also known as a mini-stroke. A TIA is a brief blockage in blood flow to the brain and often acts as a critical warning for a full-blown stroke. Ask yourself, are you feeling unusually tired day after day? Do you struggle to stay alert or concentrate, even with rest? Don't ignore these symptoms, especially if you have high blood pressure, diabetes, or a family history of strokes. Talk to your doctor if this kind of fatigue becomes your new normal. Coming up next, let's explore another early but silent red flag: sudden vision changes. 3. Vision changes. Sudden vision problems are more than just an inconvenience. They can be one of the earliest signs that a stroke is approaching. When arteries that supply oxygen-rich blood to your eyes or brain become narrowed or blocked, it disrupts the visual system's function almost immediately. You might experience blurry vision that comes on without warning, persistent double vision, or even brief moments of complete blindness in one or both eyes. Some people report flashes of light or dark spots floating in their field of view. These symptoms can be alarming or easy to brush off, but either way, they should never be ignored. What's happening inside your body is far more serious than a temporary blur. A lack of blood flow to the optic nerve or visual processing areas of the brain can indicate a transient ischemic attack TIA or the onset of an ischemic stroke. If the blood supply is impaired here, it may be happening elsewhere in the brain as well. If you notice changes in your vision that are sudden, strange, or persistent, seek medical care immediately. An eye exam can reveal early signs of underlying health issues. Next, let's uncover another stroke signal that's often misunderstood: a sudden, severe headache. 4. Sudden, severe headache. Not all headaches are created equal, and some can be deadly. A sudden, intense headache that feels unlike anything you've experienced before may be the first sign of a hemorrhagic stroke. This occurs when a weakened blood vessel in the brain bursts, causing bleeding and a rapid increase in pressure inside the skull. This isn't your typical tension headache. It often strikes without warning, described by patients as a thunderclap, sharp, crushing, and impossible to ignore. The pain may radiate to the neck or face, and is frequently accompanied by nausea, vomiting, or sensitivity to light. It doesn't improve with rest or over-the-counter medications. Another potential cause is a ruptured brain aneurysm, a bulging blood vessel that suddenly tears. Both conditions demand immediate emergency treatment. High blood pressure, heavy lifting, or emotional stress can trigger these events, especially in people with existing risk factors. If you experience an explosive headache that feels out of the ordinary, don't wait it out. Time is critical. Recognizing this sign and responding quickly can make all the difference. Now that we've addressed one of the most painful warnings, let's explore another critical symptom that often starts subtly: numbness or weakness in your arms or legs. 5. Numbness or weakness on one side. Imagine waking up and realizing you can't fully move your arm, or that one side of your face feels numb. These symptoms may seem temporary, but they are among the most urgent red flags of a stroke. Numbness or weakness, especially on one side of the body, often signals a disruption in blood flow to the brain. If a clot blocks the vessels supplying areas responsible for motor control and sensation, it can lead to partial paralysis or loss of feeling, usually affecting the face, arm, or leg on one side. It may begin subtly: difficulty gripping objects, a leg that suddenly gives out, or a slight facial droop. But these signs are not to be taken lightly. Even if the symptoms fade within minutes, they may indicate a transient ischemic attack (TIA), a mini-stroke that often precedes a full-blown stroke. Use the FAST test. Face drooping, arm weakness, speech difficulty. Time to call emergency services. Every minute matters. Acting fast can save brain function and your life. And while movement issues are easy to spot, the next symptom often hides in plain sight. Let's discuss how problems with speech or understanding can quietly signal that your brain is under serious stress. 6. Trouble speaking or understanding. To speak clearly or understand simple sentences can be one of the most alarming and easily overlooked signs of a stroke. Many people brush it off as nerves, fatigue, or confusion, but when the brain's language centers are disrupted, these symptoms are a red flag. You might find it difficult to form words, speak in full sentences, or understand what others are saying. Sometimes, you know exactly what you want to say, but your brain can't turn it into speech. Words may come out slurred or garbled. Other times, they vanish altogether, like they were never there. These speech difficulties are often caused by a blockage or bleeding in areas of the brain such as Broca's or Wernicke's area, which control language production and comprehension. Even if the problem lasts only a few minutes, it may signal a transient ischemic attack (TIA). Don't assume you're just tired or flustered. If someone suddenly can't speak clearly or seems confused by language, use the FAST test and act immediately. Because when language fails, the brain is signaling distress. Now, let's explore one more crucial sign, one that's often mistaken for simple fatigue or aging: sudden dizziness and neurological changes. 7. Sudden dizziness or confusion. Feeling dizzy or disoriented can happen to anyone. But when it comes on suddenly without a clear cause, it could be your brain warning you of a stroke. This isn't the dizziness you get from standing up too fast. It's a sense of imbalance, vertigo, or spinning that appears out of nowhere. You might feel confused, have trouble walking, or suddenly forget basic information. Even small actions, like reaching for a cup or opening a door, may feel clumsy or uncoordinated. These neurological symptoms often occur when blood flow to areas like the cerebellum, the brain's balance center, or the hippocampus, which handles memory, becomes impaired. In hemorrhagic strokes, where bleeding increases pressure inside the skull, symptoms can escalate quickly to vomiting, severe disorientation, or even fainting. What makes these signs dangerous is how easily they're dismissed, blamed on dehydration, stress, or age. But recurring confusion or loss of balance is not something to ignore. If these symptoms last more than a few minutes, or happen alongside vision problems, numbness, or speech difficulty, get emergency help immediately. Because when your brain suddenly struggles to stay balanced or focused, it's already sending out an urgent SOS. Your life and your recovery may depend on how fast you respond. Strokes are tricky. They're not always explosive. Sometimes, they creep in like a whisper in the background. The human brain is masterful at masking dysfunction until it's too late. But you don't have to be caught off guard. Remember this: a mini stroke is not a warning shot. It's the first bullet, and the second one might not miss. Your body doesn't betray you. It warns you gently, repeatedly, desperately. Will you listen? Don't wait until symptoms shout. Listen when they whisper, because the best way to survive a stroke is to prevent one from happening. If this video opened your eyes, please share it. It might save someone you love. Hit that like button, subscribe, and turn on notifications for more life-saving health insights. Have a question or a story to share about stroke recovery or prevention? Comment below. You never know who you might help. Stay aware, stay safe, stay alive.